First aid and basic life saving. First aid is the first step to help assess a person who is injured, whether self-care or home care, to help quickly relate to the personnels. First aid kits are medical equipments that can help alleviate pain to a short while and help injuries to be not more dangerous to a person. Some common injuries and illnesses are wounds, fever, headaches, sprains, fractures, and heart attacks. Bandaging and splinting techniques. Bandaging is used to hold a dressing in place over a wound to create a pressure over a bleeding wound. Provide support and immobilization for broken bones. Sprain and strains. Secure up dressing place and retain splints in place. The three general types of bandages are triangular, roller, and tailed. Triangular and caravat bandage. They are used for temporary or permanent bandaging and splinting. It is valuable in emergency bandaging since it is quickly and easily applied. It also stays well and can be improvised from a piece of shirt, handkerchief, or any material of suitable size. Dressings. Dressings are pads of gauze or cloth that can be placed directly against the wound to absorb blood and other fluids. Cloth bandages cover dressings and hold them in place. Methods of applying bandage. Circular bandage is used to anchor bandages and terminate bandages. Spiral is used to bandage cylindrical parts of the body that are fairly uniform in circumference, such as upper arm and upper leg. Reverse spiral is used to bandage cylindrical parts of the body that are not uniform in circumference. For example, the lower leg and the lower forearm. The figure-of-8 bandage is applied on the elbow, ankle, and knee. This method permits flexibility without disturbing the dressing. To apply the head top, fold the base at least 2 to 3 inches, then place folded base aligned with eyebrows. Pull back and cross over at the back, tucking apex beneath. Pull both ends in front and secure with a square knot at the center of the folded base. Pull down the apex and tuck it neatly at the crossover area. To apply the chest bandage, put the apex at the shoulder of the injured part. Pull back the folded base and secure with a square knot at the center indentation of the back. Knot or tie the longer end with apex. To apply the hand bandage, place the hand in the middle of the triangular bandage with the wrist at the base. Place the apex over the fingers and tuck any excess material into the pleats on each side of the hand. Then cross the ends on top of the hand, take them around the wrist, and tie them with a square knot. To apply an arm sling, place the folded base vertically over one arm with pointed directly under the elbow of the injured arm. Lower ends of the base at the side of the neck using a square knot. Make several twists with the apex and tie with a knot. To apply an underarm sling is the same procedure as arm sling except that the lower end of the base is tucked under the injured arm. Secure the end of the base and apex with a square knot at the center indentation of the back. To apply a caravat bandage for the forehead, place the center of the caravat over the compress covering the wound. Carry the ends around to the opposite side of the head, cross them, bring them back to the starting point and tie them. To apply the caravat bandage for the cheek or ears, use the wide caravat and start with the middle of the caravat over the compress covering the cheek or ear. Carry one end over the top of the head and the other under the chin. Cross the ends at the opposite side. Bring the short end back around the forehead and the long end around the back of the head. Tie them down over the compress. To apply the caravat bandage for the eye, lay the center of the first caravat over the top of the head with the front end falling over the uninjured eye. Bring the second caravat around the head, over the eyes, and over the loose ends of the first caravat. Tie them in front and bring the ends of the first caravat back over the top of the head, tying there and pulling the second caravat up and away from the uninjured eye. To apply the caravat for the elbow, bend the arm at the elbow and place center of the caravat at the point of the elbow. Bring both ends up and across each other in overlapping spiral turns. Continue one end up the arm and the other end down the forearm. Bring the ends to the front of the elbow and tie. To apply the caravat for the knee, start on the top of the knees, then cross over and twist 2 to 3 times under the knee. Cross over on top and pull ends on opposite sides. Secure it with a square knot under the knee. To apply the caravat for the forearm, arm, leg, and thigh, place the center of the caravat over the dressing and begin ascending turns with upper end and descending turns with lower end, with each turn covering 2/3 of the preceding turn until dressing is covered. Terminate by tying both ends in a square knot. To apply a shoulder armpit caravat, start at the armpit and cross over at the injured shoulder. Tie it at the opposite side of the armpit. A splint is a supportive device used to keep in place any suspected fracture in one's arm or leg. It is used to provide pain relief at the fractured limb, support bone ends of the fractured site, prevent bones from protruding through the skin, prevent tissue damage as well as bleeding, and facilitate safe and seamless transport. Two types of splint are rigid and flexible. Rigid splint is any rigid object such as wood or plastic boards, broomstick, book, or a rolled out newspaper which can be used to splint a fractured arm or leg. A flexible splint is any flexible object like a pillow or a bed sheet with several folds. This type is used for foot, ankle, and joint fractures. General principle of splinting. First, identify the fracture site. Second, stop the bleeding using the bandages, but avoid pressing on the fractured and painful site. Third, in case of bone fractures where bone ends protrude through the skin, do not push these ends back in place as this will cause inflammation and acute bleeding. Fourth, keep the fractured bone, including the joints above and below the fracture site, motionless. If the lower arm is fractured, keep the wrist and elbow joints motionless. If the upper arm is fractured, keep the shoulder and elbow joints motionless. If the lower leg is fractured, keep the knee and ankle joints motionless. And if the upper leg is fractured, keep the knee and femoral joints motionless. Fifth, the splint should be tied firmly to immobilize the fractured limb, then check for blood circulation to ensure the splinting is not too tight. Correct splinting should provide pain relief. And lastly, if the fractured limb is bent with a sharp bone end protruding through the skin, keep it motionless and don't forget to make the patient as comfortable as possible. First aid for fracture. Try to maintain the patient still and composed. Prevent unnecessary movement arising out of anxiety or fear, and do not move the victim unless he is in danger. Examine the person closely for the presence of other injuries and call for medical help. If medical help is quickly available, hand over the patient to them for further treatment. If there is a break in the skin surface, it can be rinsed to remove any visible dirt or other potential contamination. However, vigorous flushing or scrubbing of the wound should be avoided. The broken bones can be immobilized with either a splint or a string, rolls of newspaper, or strips of wood that can be used. It is important to immobilize the area both above and below the injured bone. A splint helps to immobilize the bone before professional medical attention can take over, and a sling can help stabilize an arm that is broken. Ice packs can be applied to reduce pain and swelling. Place gently over the site of fracture, not to be placed directly over the open wound. In case of a fracture, stop any bleeding and don't try to align the bone. Immobilize the injured area, make a splint, place it gently under the limb, and tie it to the limb with pieces of cloth. Apply ice bags to limit swelling and relieve pain. Basic life saving. Basic life support are treatment techniques to maintain respiration and circulation in the victim. Basic life support includes CPR with chest compressions and rescue breathing, and defibrillation with an automatic external defibrillator, or AED. During an emergency situation, an untrained bystander should call for emergency help and ask the dispatcher for instructions. The dispatcher would usually provide compressions-only CPR instructions to untrained rescuers over the phone. When the victim is unresponsive with no breathing or agonal respiration, a trained rescuer should immediately begin CPR. Agonal respiration is an abnormal breathing pattern that suggests cardiac arrest. CPR should begin immediately, even if the victim is gasping for air. When cardiac arrest is recognized, rescuers, trained or untrained, must initiate chest compressions before rescue breathing. The rescuer should give chest compressions to a depth of at least 5 centimeters at the rate of 100 chest compressions per minute. Singing to the beat of Stayin' Alive by Bee Gees will provide guidance in doing chest compressions. Allow complete chest recoil after each compression and minimize interruptions. CPR protocols. First, check the safety of the surroundings. Second, determine if the victim is responsive by tapping them on the shoulder. If there is no response, then the victim is unresponsive. Third, if the victim is unresponsive, call for help or ask the bystanders to call for emergency help. Rescuers should begin CPR if the victim is unresponsive and not breathing. Gasping for air is not normal breathing, but it is a sign of cardiac arrest. The rescuer should check for signs of breathing in not less than 10 seconds. If the rescuer is not confident in checking for the pulse, they should focus on checking for breathing. If the victim is breathing normally, keep the airway open and wait for professional help. If the victim has stopped breathing, begin CPR immediately. Starting CPR and chest compressions. Rescuers should push hard to a depth of at least 2 inches or 5 centimeters for adults and at least 1/3 of the anterior-posterior dimension of the chest for infants and small children. Interrupting chest compressions to check the pulse is not recommended unless there's an obvious sign of normal breathing. When changing rescuers, it should not be longer than 1 to 2 minutes to prevent deterioration of the quality of compressions. Switching should be very smooth with very minimal interruptions of the compression. AED or automatic external defibrillator. AED should be connected to the victim immediately. The pads or paddles should be placed on the exposed chest in an anterior lateral position. Other acceptable positions are anterior posterior for paddles and pads, and apex posterior for pads. In large-breasted individuals, place the pad or paddle lateral to or underneath the left breast, avoiding the breast tissue. Pediatric pads should be applied to preschool-aged children. Adult pads can be substituted if pediatric pads are unavailable, but pediatric pads cannot be used on adults. In case of victims with implantable cardioverter defibrillators or pacemakers, avoid placing the pads directly over the implanted device. The ideal pad position should be at least 8 centimeters away from the device to refrain delay of electrical shock. Shock and resumption of chest compressions. Keep off the victim when AED starts analyzing. Resume chest compressions immediately after the shock is delivered, and do not stop just to check the pulse or analyze the rhythm. Lifts and carries. As a general rule, it is important to avoid moving any sick or injured patient because of the risk of causing complications to the underlying condition. An exception to this rule includes moving a person from a life-threatening danger to a safer location. A first aider should avoid lifting a person off from the ground. The safer alternative is to drag the patient in line with the long axis of the body, using either arms or legs for traction, keeping the body aligned. The 3 kinds of pulls will be the ankle pull, shoulder pull, and blanket pull. Each of these methods has its preferred state of environment or the victim's condition, and assessing these before applying any kind of pull, lift, or carry is extremely important in deciding which course of action to take. Without the proper assessment, the rescuer might only deal with more harm than good. And so, the following slides will be about the different types of lifts and carries. Ankle pull. It is the fastest method, but it should only be done on smooth surfaces over a short distance, as this endangers the head. Shoulder pull. It is preferred over ankle pull as it supports the victim's head, but this may strain the rescuer's back. Blanket pull. This is the preferred method for dragging a victim. Place the victim on a blanket by using the log roll or the 3-person lift. The victim is placed with the head approximately 2 feet from one corner of the blanket. Wrap the blanket corners around the victim. Keep your back as straight as possible. Use your legs, not your back, and try to keep the pull as straight and in line as possible. 1-person lift. This only works for a child or a very light person. Firefighter carry. It is best for long distances, but it requires a very strong rescuer or an assistant to get the victim into position. Packstrap carry. If the firefighter carry is unsafe, This would be better for long distances compared to the one-person lift. Two-person drag. For the conscious, this carry allows the victim to swing their leg using the rescuers as a pair of crutches. For the unconscious victim, it is a quick and easy way for a victim to move out of immediate danger. Four-handed seat. For carrying conscious and alert victims in moderate distances. Two-handed seat. For carrying a victim, conscious or unconscious, in longer distances. Chair carry. For carrying victims up and down the stairs or through narrow or uneven areas. This requires a sturdy chair. Improvised stretcher. This requires two poles or pipes strong enough to carry the victim's weight and at least two shirts. The hammock carry. This requires three or more rescuers. The three-person carry. For lifting patients onto a bed or stretcher, or for transporting them in short distances. Psychological first aid. What is psychological first aid? According to the WHO, it is a non-intrusive practical care and support. It accesses needs and concerns. It helps people to address basic needs like food and water. It focuses on listening, comforting, and helping people to feel calm. It helps people to connect information, services, and social supports. And lastly, it protects people from further harm. Some PFA misconceptions is that it is something that only professionals can do. It is professional counseling, a clinical or psychiatric intervention, although it can be part of good clinical care, psychological debriefing, asking people to analyze what happened or put time and events in order, and pressuring people how to tell their story or asking details about how they feel or what happened. The benefits of PFA. It helps people feel better over the long term when they feel safe, connected to others, calm and hopeful, have access to social, physical, and emotional support, and regain a sense of control by being able to help themselves. Who is PFA for? It is for children, adolescents, parents, guardians, families, and adults who have experienced the crisis. Some people need more than PFA alone, such as children and adolescents who are separated from their guardians, people who are non-mobile or have chronic illness, hearing and visual impairments, or severe mental disorders, frail, elderly people, pregnant or nursing women, women, people of certain ethnic or religious groups, people with mental disabilities. When and where should PFA be provided? When encountering a person in distress, usually immediately following a crisis event, and any place that is safe for both the helper and the person affected, ideally with some privacy as appropriate to the situation. PFA action principles. They are prepare, look, listen, and link. Prepare. To learn about the crisis event, available resources and support, and safety and security concerns. Look. Observe for safety, people with obvious urgent basic needs, and people with serious distress reactions. Listen. Make contact with people who may need support, ask about people's needs and concerns, and listen to people and help them feel calm. Link. Help people address their basic needs and access services, help people cope with problems, give them information that they need, and connect people with their loved ones and social support groups and organizations. Providing psychological first aid to others. Educate yourself before you respond. Take care of the person's needs and concerns. Protect them from risk and further harm. Comfort and console them. Support for practical tasks. Provide them with information on coping, and connect them with social support. Here are some self-care tips you can do during this pandemic. List 5 things you are grateful for. Take one day at a time. Take a break when you need one. Use positive self-talk. Go for a walk. Read a good book. Video chat with friends and family. Stay active and eat well. Make memories with family at home. Spend less time on social media. Accomplish something on your to-do list. Turn off the news, and remember to take care of yourself first before taking care of other people. Note that help responsibly. Respect safety, dignity, and rights. Don't expose people to further harm, and ensure as best as you can that they are safe and protected from further physical or psychological harm. Treat people with respect and according to their cultural and social norms. Act only in people's best interest. Ensure access to impartial assistance without discrimination. Assist people to claim their rights and access available support. Adapt what you do not take account of the person's culture, and beware of other emergency response measures.